you.
Thank you. Okay, so good morning. Fantastic to see so many people here at this RDS information session. My name is Phoebe Wallace, my pronouns are they, them, and I'm an EDI manager here to talk with you today about what equality, diversity and inclusion mean to us at the National Institute of Health and Care Research, and what it means to you as a potential applicant to the Research for Social Care funding call. So I'll start by saying that social care research has a fundamental role to play in helping to reduce disparities that exist in how social care is delivered, who can access care and care outcomes. Social care research is the bedrock of innovation in social care practice. And yet in the past, too often, we've seen that groups who face the poorest outcomes, the most difficulty in accessing care, or the most complex needs have been underrepresented in studies, meaning that findings haven't always been applicable to these groups, thereby potentially further entrenching health inequalities. And as it says up on the slide there, RfSC is particularly interested in social care research that involves underserved communities and their social care needs. And so, as Chris said, research funded through the call is expected to have a high degree of involvement from people who draw on social care, carers, and social care practitioners. So, as you're considering your applications, how is EDI factored in? And to give you an idea of NIHR's priorities as a funder with regards to EDI, on the screen here are the 5 strategic themes which will underpin the NIHR's first EDI strategy, due to be published in the autumn of this year. And the breadth of the themes really reflect the fact that we are looking to tackle long-standing, systemic and complex issues when it comes to equality, diversity and inclusion. Not only is it about the participants involved in research or the populations who benefit, but it's also about who is conducting the research and who decides what research is funded. And so all of the above needs to be evidence-led with those opportunities for collaboration identified. And for us to see the step change needed in this area, as well as recognising the role that we as the NIHR play, we need stakeholders from all parts of the system to be involved and take ownership. Now, an action plan will follow the publication of the strategy later on in the year, so you will be able to see in much more detail the specifics. But to mention, last year, we launched our first diversity data report, which gave an overview not only of the makeup of our funding committees, but also applicants and award holders. So if you do apply and you're asked for your equality monitoring information, please do provide it, as this data is anonymised, and it really allows us to monitor and inform our future EDI activity. Moving on then to what you as potential applicants can do to embed EDI. And first of all, I want to draw your attention to the excellent EDI toolkit from the Research Design Service. Taking various elements of the research cycle, they provide a series of prompts, case studies, useful links and resources to inform your consideration, right from initial idea through to dissemination, implementation and impact. And talking through a couple of examples briefly. So for example, when building your research team, how diverse are they? If they're a largely homogeneous group, are you going to miss out on different perspectives which could enrich and strengthen your research? It's not only about diversity and representation, of course. To be able to build relationships, gain trust, and work well with diverse populations, your team will also need to be culturally competent, being able to recognise when their judgments might be influenced by their own backgrounds, and understand and respect cultures different to their own. On data collection, prompts such as how equitable is your data collection strategy? When collecting participant equality data, what characteristics are you collecting? How are your questions worded? And as you go through and consider all of these areas, for multiple characteristics, you might be thinking how best to structure this consideration. So moving on then, an equality impact assessment is a really useful tool to bring together all your evidence, evaluation, analysis of impact, and action plan around equality, which can then function as the core of your EDI plan or strategy. So up on the screen here is a toolkit produced by the Applied Research Collaboration Centre in the East Midlands, alongside the Centre for Ethnic Health Research. And it's a really helpful guide that will take you through the necessary steps. Whilst the toolkit does take the ARC requirements for their particular funding streams as its starting point, many aspects of this toolkit are applicable across to research for social care applications. And there's prompts included in there to help you consider how you can adapt the toolkit to your own specific needs. And the ARC have seen that the increased use of EIAs, equality impact assessments, has had some of the following effects. So researchers widening their equality focus and appreciation, considering issues in their approach that they hadn't thought of before. An appreciation of the need for tailored approaches and that one size does not fit all. Early evidence of changes to trial design and to planned methods of recruitment and engagement through a better understanding of communities and appreciation of intersectionality. Recognition that equality analysis is a process and that it will change either fundamentally and or in more subtle ways as the study progresses. Consideration of issues of stigma and discrimination, and recognition of the importance of accessibility and the need for a flexible and varied approach to disseminating information and to planning focus groups and workshops. What's really key here is that equality, diversity, and inclusion is not simply a box to be ticked. Its consideration needs to be meaningful, deliberate, and iterative. And completing an equality impact assessment will help ensure that this is the case. So as I draw to a close with this short session, I hope the key takeaways for you are that NIHR is committed to embedding EDI throughout the health and care research system, and that you have a fundamental part to play in that. It's only through all of us pulling the levers that we have available to us that we can affect the change that is needed to ensure that we start to tackle some of the long-standing disparities in care outcomes we see today. I've listed on the screen the resources that I've highlighted today, as well as a few more, which I think will be of use. And my team's email address is on the screen. And whilst we can't advise on individual applications, we can assist with more general EDI inquiries. So please do contact us if you need anything further. That's my presentation concluded. Thank you.